After studying this module, you shall be able to understand the nature of personality assessment, learn about different sources of personality assessment, and learn about ethical issues in personality assessment. Personality assessment may be defined as the measurement and evaluation of psychological traits, interests, attitudes, cognitive and behavioral styles, and related individual characteristics. It consists of procedures for identifying similarities and differences among people in their personal characteristics and capacities. It plays an important role in psychological science and practice. Measures of personality characteristics help researchers examine individual differences in response style, unravel the origins of distinctive behavior patterns, and map developmental paths to diverse types of life adaptation. It also helps practitioners discern the individual's frame of mind and behavioral tendencies. They can use this information to reach relevant conclusions and make useful recommendations in a broad range of healthcare, forensic, educational, and organizational applications. Personality assessment in healthcare settings can be helpful in identifying psychological aspects of physical illness, monitoring adaptation of chronic illness or disability, estimating tolerance for surgical procedures, and revealing the sources of an unhealthy lifestyle or poor compliance with prescribed treatment. In forensic settings, personality test indications of mental impairment can contribute in criminal cases to determinations of competence and sanity. In educational settings, we can identify the need to provide counseling or special education services for students with conduct or learning problems with the help of result of personality assessment. In organizational settings, personality assessment can prove useful in evaluating candidates for employment or promotion, and test findings can help determine the fitness for duty of persons who have become psychologically impaired. Sources of data in personality assessment. The personality characteristics that define the nature and dispositions of an individual can be assessed in several ways. The first is interview. Interview is the core of any psychological assessment. The interview is focused on assessing the status of a particular individual. Researchers can ask different types of questions, which in turn generate different types of data. For example, closed questions provide people with a fixed set of responses, whereas open questions allow people to express what they think in their own words. Sometimes, researchers use an interview schedule. This is a set of prepared questions designed to be asked exactly as worded. Interview schedules have a standardized format, which means the same questions are asked to each interviewee in same order. Interviews can be of several forms. First, structured interview. Structured interview is also known as a formal interview, just like a job interview. The questions are asked in a set or a standardized order, and the interviewer will not deviate from the interview schedule or probe beyond the answers received, so that they are not flexible. These are based on structured, close-ended questions. The second type is unstructured interview. These are sometimes referred to as discovery interviews and are more like a guided conversation than a strict structured interview. An interview schedule might not be used, and even if one is used, they will contain open-ended questions that can be asked in any order. Some questions might be added or missed as the interview progresses. The third is clinical interview. Outline for a clinical interview comprises of following steps: identifying information, presenting complaints, history of present illness, past medical and psychiatric history, past personal history, family history, pre-morbid personality, level of insight and motivation, and collateral history. Identifying information. This information typically includes basic demographic data such as name, gender, age, race, and marital status. It is helpful to have this type of information when the interview begins, as it helps to guide the interview process as it progresses. Presenting complaints. This is the detailed account of the patient's central problem that led the patient to seek treatment. This is usually elicited by a fairly standard question such as, "What brings you here today?" History of present illness. This is a description of the current complaints that the person has. This requires detailed elaboration, often using the person's own words and supported by a relevant functional inquiry. It includes nature of problem, onset, progression, maintaining, precipitating factors, and associated symptoms. Past medical and psychiatric history. Obtaining a medical history is necessary regardless of the problems patient presents. This includes inquiry about past or current physical or psychiatric illness, time for which problem persisted, and any hospitalizations required. Past personal history. This consists of the person's prenatal history, attaining developmental milestones, educational history, which gives a lot of information about personality and intelligence, problems faced during adolescence, employment history, chronologically listing patient's job, durations, and reasons for leaving the job, and the marital history. Finally, one should also cover the past and the present use of drugs, alcohol, and cigarettes. Family history. Understanding a person's problem requires the understanding of the person's family. Drawing a genogram is the clearest way to present the family. Important information includes number of family members, their age, and family history of major illness. Pre-morbid personality. In this segment, one tries to understand what the person was like before they became unwell. Level of insight and motivation. This refers to the awareness of the patient about his problem and motivation to change. It also takes into account the patient's willingness to accept therapy and his expectations. Collateral history. A history from someone such as family and friends who know the patients well is collected and particularly useful when the person can't or won't talk. Other people may be better placed than the patient to declare whether behavior or personality has changed. Objective self-report techniques. With the help of objective self-report inventories, individuals provide information about their thoughts, feelings, and behaviors in response to standardized items contained in personality tests. Both the response alternatives available for the items in these tests and the procedures for scoring the response are standardized in that they are the same for anyone completing the test. The logic is that by treating all participants the same way, potential biases in interpretation of results are controlled. The standardization of test items and procedures for scoring the responses adds to the ease in level of administration and also increases the reliability, that is, the characteristic of objective self-report techniques. Objective self-report inventories are of two types. First, single dimension personality tests, and the second, multiple dimension personality tests. Single dimension personality tests attempt to measure only one dimension of personality. Example, shyness, creativity, or aggression at a time. A classic example of a single dimension objective self-report personality test is the California F-scale. The F-scale is designed to measure authoritarianism. Another excellent example of a frequently used single dimension test is the self-monitoring scale. This refers to the extent to which individuals monitor or regulate the nature of their public appearance during their interactions with others, such as act surprised when they are not. Multiple dimension personality tests measure more than one dimension of personality at a time and tend to contain a much larger number of items than a single dimension test. The California Psychological Inventory is a multiple dimension personality test that contains 462 questions and measure 20 different personality dimensions such as dominance, self-control, self-acceptance, and flexibility, to name a few. The problem of response sets subjective influence on objective tests. A response set refers to a tendency to answer test items in a particular way regardless of how the person taking the test really feels about the content of the item. Different response sets are as follows. The acquiescence response set. It refers to the tendency of the person to respond to with agreement to test items for which there is some uncertainty. The social desirability response set. It is characterized by the tendency to select the responses appearing the most socially desirable. The extreme responding response set. It is characterized by the tendency of a person to choose the extreme items of the scale. The middle responding response set. This refers to the tendency of a person to avoid extreme alternatives and choose the middle ones. The random response set. This kind of responding refers to the random responding by the participant without putting much thought into an item. Although such response sets can be problematic, they can be minimized by developing and including validity scales in the test to identify and correct the test score. To reduce social desirability, researchers can drop the questions which are likely to evoke it. Paraphrasing can also help to a large extent in minimizing the bias. Projective techniques. Projective techniques of personality assessment involve asking individuals to respond to ambiguous test stimuli with no apparent meaning. The underlying assumption of projective technique is that the meaning the person gives on to the ambiguous stimuli indicates the person's own unconscious feelings, needs, desires, attitudes, motives, and other central personality aspects. The examples are Rorschach ink blot test and thematic apperception test. There are a variety of projective techniques sharing the following characteristic features. Ambiguous test stimuli. In projective techniques, the testing stimuli are relatively ambiguous. Indirect method. Instead of responding directly to items like on objective self-report techniques, projective techniques take a much more indirect approach to personality assessment by requiring the individual to respond to ambiguous stimuli. Freedom of response. These techniques allow for more freedom in responses to the test stimuli. because stimuli are ambiguous, there is no right or wrong responses. Subjective nature of scoring procedures. Although attempts have been made to standardize their scoring, a considerable amount of subjective interpretation of the responses by those scoring the tests is a common characteristic of projective techniques. Behavioral techniques. In sharp contrast to assessing constructs that characterize the objective self-report and projective techniques, behavioral techniques of assessment emphasize the systematic observation of behavior as the basis for assessing the personality of individuals. Because behavior can be determined by many factors, personality psychologists using these techniques to study personality attributes also focus on what cues in the environment elicit the behavior, what thoughts and feelings influence the behavior, and what the consequences are for engaging in such behavior. Thus, behavioral techniques attempt to assess directly the more observable dimensions of personality. Different behavioral techniques are as follows. Direct observation techniques. They refer to the actual obtaining samples of the individual's behavior. Such observations can be obtained in a variety of formats. Naturalistic observations involve viewing the individual's behavior in real-life settings. Controlled observations involve evaluating the behavior in more structured situations. Role-playing, which combines the naturalistic and controlled observational methods, involves a person playing an assigned role for the purpose of assessing the individual's behavior in various situations. Baseline observation. Before any treatment or intervention has made, the response frequencies in a particular situation is recorded. This recording of response frequencies is called baseline observation. There are various ways in which this can be used. Observations are made to explain a person's response repertoire at a given time. For example, one can record the number of aggressive responses made by children of different ages. Such observations also make available a baseline for judging the effectiveness of behavioral modification techniques. We can compare the baseline measurement with a similar set of observation which is recorded just after the behavior modification procedure as a way of determining how well the therapy worked. Behavior rating scale. In behavior rating scale, the observer notes the presence or intensity of targeted behavior, usually by checking in box or filling in coded terms on a pre-printed sheet. Sometimes, coded descriptions of various behaviors is used by the user of a behavior rating form because it takes much less time to enter data and thus frees the observer to enter data relating to any of the hundreds of possible behaviors, not just the ones listed on the sheets. Analog behavior observation. It is the observation of a person or persons, that is, includes the clients or the research subjects, in an environment designed to increase the chance that the assessor can observe targeted behaviors and interactions. The targeted behavior depends on the objective of the research. For a client who avoids hiking because of a fear of snakes, the behavior targeted for assessment is the fear reaction to snakes, most typically elicited while hiking. This behavior may be assessed and treated in analog fashion within the boundaries of a clinician's office using photos of snakes, videos of snakes, or live snakes that are caged and live snakes that are not caged. Self-monitoring techniques. Self-monitoring techniques require individuals to maintain observational records of their own behavior. Example, noting when and where feelings of anxiety appear. An advantage of self-monitoring techniques is that they can be applied to a variety of different types of behavior. Another advantage is that they are very convenient and flexible in that they can be done almost anywhere and at almost any time. Self-report behavioral inventories. Self-report behavioral inventories typically require individuals to indicate the extent to which they have engaged in a series of specific behaviors in different situations. Self-report behavioral inventories are capable of assessing a wide variety of behaviors such as depression, assertiveness, and ability to resolve conflicts. Possible threats to the reliability and validity of self-report behavior inventories exist because they tend to rely heavily on a respondent's memory and willingness to admit to such behaviors. Cognitive behavioral assessment. Cognitive events are the activities occurring in the person's brain that influence behavior. Techniques of cognitive behavioral assessment attempt to measure a person's thoughts or feelings while in a particular situation. The technique of thought sampling requires the individual to monitor the thoughts. Example, all those people are evaluating me. Experienced while in certain situations, example, giving a speech, that can be used to explain the observed behavior, example, fumbling over words. Self-statement inventories require the respondents to read a series of statements describing the types of thoughts people may have and then to indicate the extent to which they endorse these statements for themselves. Psycho-Physiological techniques. The essential logic of the psycho-physiological techniques of personality assessment is that certain aspects of individual's personality, example, aggression, anxiety or risk-taking, are related to various bodily processes, example, blood chemistry, hormonal levels, heart rate. Psycho-physiological techniques of assessment are characterized by their ability to measure a variety of physiological changes occurring underneath the skin and linking them with various cognitive and emotional aspects of behavior and personality differences. Different psycho-physiological techniques are as follows. The electrocardiogram or ECG is an instrument that assesses changes in electrical activity of the heart and thus makes it possible to assess heart rate. Changes in heart rate are associated with different levels of arousal and excitement as well as indicating cardiac disorders. Personality researchers have used ECG measures extensively to study the relationship between coronary heart disease and personality factors. The electromyograph or EMG is a technique that measures muscular activity associated with muscle tension and relaxation. The EMG is used extensively as a therapeutic technique to help individuals suffering from excessive stress and anxiety learn to relax by receiving muscle relaxation training. Techniques assessing electrodermal activity or EDA. A frequently assessed EDA is galvanic skin response. GSR is a measure of the skin's level of moisture, example sweat, in response to various physical and emotional states and is assessed using a galvanometer. A somewhat controversial topic is the accuracy of the GSR when used in the context of a polygraph or a lie detector test. At the base of this controversy is the notion that the polygraph does not really detect lies but detects those bodily changes, example perspiration or increased respiration rate, associated with the arousal assumed to be associated with telling a lie. The plethysmograph. The plethysmograph is an instrument that records changes in volume of a part of the body arising from variations in the blood supply. Investigators have used this device to explore changes in blood flow as a dependent variable. Examining the blood samples. These allow for assessing the levels of neurotransmitters such as monoamine oxidase, serotonin, and dopamine. Neurotransmitters affect the operation and communication of the neurological system in the brain. For example, MAO is a contributing factor in the desire for seeking excessive exciting stimulation associated with the thrill-seeking personality. Measuring hormones like testosterone and cortisol. Biochemical assessment of neurotransmitters and hormones can be obtained by analyzing cerebrospinal fluid, blood, saliva, or urine. Testosterone has been linked to dominance, aggressiveness, and various forms of antisocial behavior. The electroencephalogram or the EEG is an instrument for assessing the electrical activity of the brain occurring in the form of various brain waves, which are the wavelengths displayed on a visual monitor. A computer is used to convert the electrical activity to this visual display. While different wavelength patterns are not used as a direct measure of specific traits, researchers have associated them with personality characteristics such as extraversion and impulsivity. The positron emission tomography or PET technique uses an X-ray-like scanning device to assess the rate at which brain cells use energy-providing substances like sugar or oxygen when responding to stimulation. The faster the rate, the more activity associated with the cells in that area of the brain. A computer is used to create a visual image of the brain on a monitor that highlights in different colors the rate of energy used in different regions. Magnetic resonance imaging or MRI. An MRI scanner uses a strong magnetic field and radio waves to create pictures of the tissues and the other structures inside the brain on a computer. The magnetic field aligns the protons or the positively charged particles in hydrogen atoms like tiny magnets. Short bursts of radio waves are then sent to knock the protons out of position, and as they realign, which is the relaxation time, they emit radio signals which are detected by a receiving device in the scanner. The signals emitted from different tissues vary and can, therefore, be distinguished in the computer picture. The functional magnetic resonance imaging or the fMRI technique is similar to that of the PET scan, but assesses the magnetic properties of blood before and after the oxygen is used as energy in reference to an external magnet contained in a scanning device that takes rapid images of the brain while it is at work. Computerized tomography or CT. Computerized tomography scans use X-rays to show the structure of the brain with details such as blood perfusion. The resultant images are two-dimensional and of comparatively low resolution. However, the quality has been much improved. With improved technology, the single section has now become a multi-section and the speed has increased 8 times, giving well-defined 3D pictures. A CT scan may reveal underdeveloped parts of the brain or sites of injury from impact, tumors, lesions, or infection. Evaluation of psycho-physiological techniques. Psycho-physiological methods are very useful. They are usually quick and painless. These techniques can help to diagnose and guide treatment for a wider range of conditions. Additionally, they can also detect or exclude the presence of more severe problems. Finally, psychophysical methods can be used to check if a previously treated disease has returned. However, these methods also have certain demerits. Firstly, certain procedures can be lengthy and noisy. MRI can make some people feel claustrophobic. There might be small increased risk of cancer in future from exposure to ionizing radiations like X-rays. Sedation or anesthesia may be required in some cases. Ethical issues in personality assessment. A personality test becomes more widely used, their potential for misuse and abuse also increases. In this section, personal, legal, and social issues associated with the ethics of personality assessment are presented. Personal concerns protecting the rights of the individual. Invasion of privacy. A major concern for many individuals taking personality tests is that they will unknowingly reveal things about themselves, an invasion of privacy. Whenever possible, individuals taking the test should be given a complete description of the purpose of the test and testing procedures in language that they can understand but without contaminating the results of the test. Under no circumstances should the individual be deliberately deceived or coerced into taking the tests under false pretenses. To deal with such ethical concerns, the procedure of informed consent is practiced by responsible individuals using personality assessment techniques. Confidentiality. The issue of confidentiality has to do with who will have access to the information obtained from the tests. To help ensure confidentiality, individuals should be told beforehand how the results will be used, that only those persons for whom the results have direct relevance will have access to them, and that permission from individuals must be granted prior to the results being released to any outside sources. Finally, it is the responsibility of those doing the testing to eliminate dated or obsolete information. For example, information located at a university counseling center about a student's level of depression during the freshman year should be eliminated after graduation. Legal concerns, assessment and the law. Whether used in clinics, universities, the military or industry, one cannot use personality assessment if the items in or procedures of the test tend to discriminate against certain groups of individuals. For example, individuals from certain minority and ethnic groups might score lower on a management selection test than Caucasian individuals because the group's cultural norms dictate that input from various family elders be considered before a decision is made regarding the group members. Such people might score lower because their tendency to avoid making individual decisions could make them appear more indecisive as potential managers than those from individualistic cultures that emphasize independent decision-making strategies. Thus, the difference in scores might reflect cultural beliefs about group interactions more than actual management ability. Such a state of affairs is considered discrimination against these minority individuals when only those scoring high on the test are admitted to the company's management training program. Social concerns, assessment and society. One of the biggest social concerns about the large-scale use of assessment techniques is labeling. This issue has to do with what can happen when a negative label is attached to an individual on the basis of the results of these techniques. For example, Consider what can happen to an individual who has been labeled as emotionally disturbed on the basis of a set of personality tests. First of all, other people may react to this person differently because of the label. Example, they may treat him or her in an impersonal manner. Because people are now treating this person differently, the individual may eventually come to internalize the label of being emotionally disturbed and start exhibiting negative behaviors like hostility and social withdrawal. Such bizarre behavior will then serve to reinforce the label and the differential treatment the person now receives. In short, the label becomes the beginning of a self-fulfilling prophecy. Summary. Personality assessment consists of procedures for identifying similarities and differences among people in their personal characteristics and capacities. There are 5 sources of personality assessment: interviews, objective self-report techniques, projective techniques, behavioral techniques, and psycho-physiological techniques. There are 3 ethical issues in personality assessment: personal concerns, that is protecting the rights of the individual; legal concerns, that is assessment of the law; and social concerns, that is assessment and society. Thank you.